Y'all know me, I'm Dr. B, and this is the buzz on oral thrush. Oral thrush is a fungal infection in the mouth caused by an organism called Candida albicans. It's a fungus. And Candida is in our environment, but usually it doesn't cause a problem because our immune system takes care of it pretty easily. However, the part of the immune system that fights fungi doesn't work as well in babies and young children, so they're at risk for getting candidal infections in their mouth, in their skin, and other places. Kids who use antibiotics or steroids, especially inhaled steroids going in the mouth for asthma, they're also at risk of developing thrush. Oral thrush looks like a white coating inside the lips, on the gums, and on the roof of the mouth. Specifically, it shows up in those areas. Sometimes it'll be on the tongue, but it can be a little tricky to diagnose it just from it being on the tongue. Here's another picture of thrush on the palate, and there you can see it's heaped up on the tongue, pretty lumpy. Thrush is difficult to wipe off, and usually we try to scrape it off with a tongue depressor in the office, so we make sure it's not just some food or milk or something that's on there. But you'll see that when we try to scrape it off, it won't come off because it sticks to the cheeks because it's actually growing there. A lot of people come in because, especially on young babies, the tongue looks a little bit white, but the tongue can have a light whitish coating in babies and younger children, and this is normal. So don't confuse this with thrush. Basically, if you see a light coating on the tongue only, and you don't see it in the gums or on the lips, that's probably what we call milk tongue, which is just a little residue on the tongue from drinking milk. Real thrush on the tongue should look more like this picture. It's usually pretty thick and heaped up, and it looks like cottage cheese-like lumps. It can be painful, so kids may not want to drink. Actually, they'll still have an appetite, so they'll try to drink, but often they'll pull off repeatedly while they're drinking and be upset about it due to mouth pain. Sometimes oral thrush can be associated with a fungal diaper rash infection. And if you want to see more about that, you can check out episode 31 of this podcast, Diaper Rashes, for more information on fungal diaper rash infections. Diagnosis doesn't require any kind of special testing. Some people will look at it under a microscope, but we can pretty much tell what this is just by looking at it and hearing about the history. Treatment of thrush is pretty simple. It's a fungus, so we use antifungal medications. The most common one we use is called nystatin, and the way we give it is we take 1 milliliter or 1 cc of nystatin and squirt it in one side of the cheek, squirt it in the other side of the cheek. Do that 4 times a day. It may take up to a couple weeks to go away, but in the end, the nystatin should work. Sometimes we have to use another medicine called fluconazole, but most of the time, the nystatin should get rid of it pretty easily. Like we said, thrush can be associated with taking certain medications like overuse of antibiotics or overuse of steroids. Especially if a child is inhaling steroids, like if they have asthma, you want to make sure that they rinse out their mouth after they use the inhaled steroid. As far as feeding, making sure that we sterilize nipples, sterilize pacifiers, and if any of them look yellowed or cracked or old, you just got to throw them out and start over with some new ones. If mom is breastfeeding and she's feeling some burning, especially kind of a deep breast pain when she's breastfeeding, you might want to talk to her doctor and make sure that there's not yeast in the milk ducts or on the nipples. Thrush may be annoying, but it's not dangerous as long as the child is eating well. So if you have any other questions about thrush, just give us a call or bring your child into the office. We'll be happy to take care of the problem for you. It's not that difficult. Well, thanks for watching today. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.